We are here in Próspera. Próspera is a free private city. In fact, possibly the first, but definitely the most advanced. They created it here in Roatan, Honduras. And we can see some really exciting things. Every corner, it seems there are like a gene therapy dealers. So my first question to you, one of these gene therapy dealers, is what could possibly go wrong?
Próspera, it's like a sandbox for experimentation of new regulatory frameworks. And I'm not sure if something can go wrong with Próspera. Maybe some like pharma company would not like that and they will try to stop it. Some opinions on that, but I don't believe that it's an issue because even big pharma companies, they also interested in longevity drug because it will be the drug that everyone is buying, right? So I'm not sure. Like here were some issues with the government, but the government against the change and about to change, and like I don't see any risk for Prospera that much. A lot of talks about even opening some other special economic zones. And many countries seem to be interested on that. So I think it will be just growing. Regarding our gene therapy, so currently we have only one gene therapy here. We have unlimited bio. We are second company who got approval for gene therapy here. So currently here in Próspera available two gene therapies. First one is follistatin by Minicircle, and second one is vascular enteric growth factor or VEGF, brought here by Unlimited Bio. We aim to bring much more gene therapies here, up to 5 more gene therapies this year. We partnered with BioViva, founded by George Church and Liz Parrish, who has been in this gene therapy field for a while. Regarding our first gene therapy, vascular enteric growth factor, it has been approved for a disease since 2011. More than 10,000 people has taken it so far, and we have a really long-term safety profile. So the first human who took it, it was like back in 2009. So we have a long-term 15 years and more than 10,000 people. So for a disease, for sure, it's lower limb ischemia, initial indication. We licensed it, brought it here for repurposing. So probably this gene therapy has the highest safety profile among all the gene therapies worldwide. But regarding other gene therapies, it's still experimentation. It's the same that can happen with all the drugs that we in the clinical trials, right? People have side effects and sometimes really serious side effects. So it's also a risk for some. It may be a risk for some gene therapies, yeah. But we always studying and do it carefully with increasing of dosages and stuff like that. So I think the only thing can go wrong here is the same with the classical regulators. Like when you take a drug, we always end up giving a drug to first human.
Yeah, but I would add that as a company, we carefully check what kind of therapies we would like to provide for patients, for people here. And that's why we've started with plasmids form of our first therapy, because plasmids are pretty safe. And as Ivan said, it's wide and big history of using this gene therapy for other people. And also when we are considering other gene therapies as AAV-based gene therapies based on viral vectors, we make it very carefully, just not start with big dosages and to administer it in local sites of the human body, not like just directly to systemic administration, but like local and very safe route of administration. So we really put the safety at the first place.
My name is Ivan. I have been in the longevity biotechs for a while. I have been involved in multiple longevity biotechs, age-related drug R&D, and the understanding that the biggest bottleneck for us to solve aging is over-regulations. And this understanding brought me here in Próspera to start another company, Unlimited Bio. with the aim to accelerate the progress in the field and build a rejuvenation cocktail that will consist with all the possible available, the best available therapies so far. It's maybe gene therapies or even non-genetic intervention and lifestyle practice if we want to combine it all together to give it to one shot to human to complexly rejuvenate immune system, physical function, and cognitive function individual.
Yeah, my name is Anna Lakhrusheva. I'm a scientist and I'm bioengineer with PhD and over 10 years of experience in science, development of different therapies. I've started to develop first like my therapy. It was the vaccine against COVID, and we were able to put it through like from the prototype to advanced clinical stages in just 2 years. And it's a remarkable pace for biotech company because usually it takes around 10 years to develop a drug and put it and lead it to the market. So I also work with other first-in-class and best-in-class therapies in Russia in other biotech companies. For example, we are developing like the first vaccine against cat allergy. It's first-in-class treatment for these diseases. But most of the time I'm trying to focus on longevity therapies. I work also with gene therapies in different formats. And I'm CTO of Unlimited Bio. So currently I'm focusing here on this combinational approach to treat different organs and like systems regarding the aging process.
Okay, so what combination are we talking about here?
Now we want to assemble this cocktail from all the best practices, try to find synergetic effects between interventions. And it's not, I don't think that it will be ultimate solution. I just want to, people tried some gene therapies, people tried some interventions, maybe people tried to sleep better and eat healthier, but no one really tried to combine multiple intervention, trying to tackle multiple bottlenecks of our longevity or multiple hallmarks of aging. Yeah, so we want to combine this year for our XPRIZE protocol for gene therapies and around 10 non-genetic interventions and add to this the best lifestyle practices. It will be just the beginning, because after that we will have a cocktail of treatments that we will be able to start adding things to it. My belief that first real solution in the aging field will consist from dozens of therapies, and not therapies like supplements. Supplements, it's like getting by bicycle to the moon. It's impossible. We need more serious interventions that can really make a difference. And even at least one intervention is not enough. One drug approaches, it's last century. One process approaches. We need combine things. They're looking for synergetic effects. But even when we build this combination of 4 gene therapies and 10 non-genetic interventions, we won't stop there. We will start to work on other type of bottlenecks that's extremely important, like bottlenecks of our longevity, things, processes in our bodies that limit our lifespan, by maximum 80 years, 100 years or something like that. We will keep tackling those processes and we'll add it to the cocktail and keep adding it. For example, we have to remodel tissue elasticity in our body and many things like that we don't even have treatment now to put it in the cocktail, but I expect it to be happening in the future, and we will have this infrastructure that's with a fastest feedback loop when you just in 3 to 12 months keep adding things to the cocktail.
Mm-hmm. And maybe I would add why it's a combinatorial approach, because as we see organs in the humans, they age differently. So some organs age first, some maybe a little bit later. We have this cardiovascular system that connects all of the organs. So it could be somehow related, but anyway, each organ has this specificity. And if you're talking about gene therapies or other therapies, they're focused on some specific mechanisms that would be different organs, and that's why we combine different interventions and gene therapies for each like big system. For example, we use one therapies for the muscles, one set of interventions for the immune system, another one for the cognitive, because they need different approaches. They are different. That's why like we have so good specificity of our organs at the body. That's why it would be the combinatorial approach, because we couldn't tackle just with one approach to all the problems that our body has.
Can we break it further down? So different organ systems aging differently, but how about different parts of a single organ? Are they also damaging aging differently, or that's not how it works?
Generally, it would concerns like most of the organs. Of course, some process starts from the small part, and after this, they distribute all around the organs and tissues. But suppose if we could tackle this like preventive changes, we actually should tackle this first and early changes in the organs and tackle them to prevent their distribution to all the organs. But it's a really interesting question, it's a difficult one, because most of the existing drugs, they aims on the process when these changes already happened in like on all organs. They're very visible and very like we can see, we can feel them. It's usually like the disease stage. But when we are talking about prevention, it starts from the tiny like small cells, several cells, and so on. But for now, it's currently very difficult to determine it in order to change this.
Are you guys familiar with Symphony Age, or the more the scientific research name of it is Systems Age? So there are these epigenetic clocks, right?
Yeah.
And one of the criticism of them is that even if they would be accurate, then it would still not be very useful. So what Systems Age or Symphony Age is doing is that they actually give epigenetic clocks, so biological age, instead of your entire organism, it gives biological age for your organ systems. I believe 9 organ systems.
Yeah, I saw it in for the Don't Die Summit. Yeah, like epigenetic clocks for each organ. Is it the one? Yeah, I think even Dave Pascal said that the results are all over the place, right? In your interview, I think. First of all, like we don't use any epigenetic clocks in our work. Like even like if you do something in mice or we do something on human, we never measure. We have never measured the epigenetic clocks. Like there are a lot of doubts about the whole thing, and you told me that you recently watched also like the video from Matt Caberlain about testing all this thing. Yeah, but we never tried even before that video. It's crazy. And but what we really care about aging, first of all, talking to us, you understand how old are we. Like I can guess how old are you. You can guess how old are we. And even like doesn't matter how like our epigenetic clocks, what they will show, you will still consider us around like 30. She's like definitely 18, right? But yeah. But so you understand that I'm around 30 to 40, something like that. You can understand that. And what I'm really care about as a person, because I'm building this solution for myself, what do I care? Do I care about some biomarkers that some scientists can only see in the lab? Do I really care about it? Yeah, it's nice when they put numbers and say it's my biological age, but is it like, I don't care. All the blood biomarkers, yeah, I know that Anna has a bit different vision, but for me it's important, like my physical function, how fast, how easily I can run, just stand up now and jump, right? Or like how easily I can recover after my training, how high is my VO2 max, but how easily I can get increased VO2 max, how easy I can, ratio between how much I train and how easy I get the results. This is what I get, or how my immune system, how many times during last year I got sick, like, right? How easy I recover after COVID, or I don't know, how easy I can learn new languages, how good is my memory, how easily I can solve complex tasks. Those things I really care about. And that's why we try to focus on some biomarkers or measurements more connected with, we divide it on 4 segments. So it's muscular function. Actually, it came from XPRIZE. XPRIZE has three functions that they measure:
Okay.
physical function, cognitive function, and immune function. We added to that also aesthetics, because we believe that skin is very interesting thing to work with, because it's easy to deliver things and easy to measure, and people really care about their skin. So we add 4th component to it: aesthetics. So physical, immune, and cognitive function. That's what we would like to rejuvenate. And there we have to look for some types of biomarkers that are also meaningful. For example, for physical function, it could be, as I said, not just VO2 max, because people care about VO2 max, but all these professional athletes, they have VO2 max like 90. Some of them have 90 plus VO2 max. But they still do not live longer than average. But what differs the 20-year-old from 60-year-old, how easy during like trainings that person can get higher VO2 max. Not just VO2 max, but how easily we can get there. And this, defines our age. How less, I don't care. Like some people spend in the gym 5 hours, right? And have some nice results and get like pushed, and whatever. But I would like to spend less time in gym and get better result. It's what's happening when we are 20-year-old. I saw this thing, but what is it? What is it in this tool with epigenetic clocks? For me,
Just correlation. Yeah.
yeah, and how usable it is for us. Like it's just like a speedometer, but it doesn't mean that car goes so fast. Like you can just sometimes cheat with speedometer, and the car will be still old, right?
Yeah, maybe I would add that we should divide the biomarkers by which we assess the efficiency of the gene therapies, and like kind of biomarkers when we need to develop gene therapies. Because for scientists, of course, I can't relate to this physical aesthetics when I develop some gene therapies for molecular mechanisms. I need biomarkers for these molecular mechanisms. So I was talking about this regarding when I develop some interventions and gene therapies. But yeah, if we need to assess the efficiency of the treatments, I believe that functional assessment is the best one that we have right now.
Regarding your just point about aesthetics, we software developers figured it out that what looks better works better, even though they have the exact same functionality. They actually work better for the user. It's crazy.
Interesting.
And another thing to your point is that you wanted to make a point there about epigenetic clocks, that we don't really know. Let's say a murder happened and there are some fingerprints.
Yeah.
Okay, so we can see the fingerprints.
Yeah.
And what we can do with those fingerprints, we can just wipe them down, and we don't undo the murder, So we are not quite sure if by improving epigenetic clocks, we are wiping down the fingerprints or actually go to the root of the issue.
Correlation or causation? This is the thing. We need causation. We don't want just correlation.
And there is a philosophical debate if correlation or causation even exists, but it's not going to. But you brought up the XPRIZE,
right?
XPRIZE. So that's very good, because that's the whole reason why you guys are here. Because this podcast is called Immortal Combat, and I am interviewing longevity athletes or people who are working on sport competition around longevity, and XPRIZE is that. But My first question is, so you have a team in XPRIZE, but my first question is just because I've never talked about the XPRIZE here before. What is the XPRIZE?
Yeah, XPRIZE is the competition. XPRIZE Foundation. It's a foundation that has been has existed for a while. They do different type of competition for technologies, and recently they started XPRIZE Healthspan competition. That is about longevity. In the longevity field, it was founded by Evolution Foundation, one of the biggest foundation in the field, and few other people. It's led by Peter Diamandis, also quite a famous figure in the field. So the idea there that it's $101 million prize for a complex rejuvenation of a human being. So the one who will show the bigger rejuvenation will get the biggest part of the prize. So it starts, currently there are around 600 teams registered, and 40 teams will get to the semifinal. So it will be known, I think, in a few months. They will announce it. Those 40 teams, I hope we will be among them, will get the first part of the prize, $250K. For like it's a grant thing. After that, they will show some safety testing of their treatments and report the results. I think it will take around a year or a year and a half. And after that, the best 10 results the best 10 teams will get to the final, where each already gets immediately $1 million. So it's already distributed around $20 million, right? And so the best winner among these 10 will get something like $10 to $20 million. I don't remember. Depends of your results. So minimum, the winner gets something like $10 million, something like that. And but if you make the best result, like the best expected result by them, you will get up to rest of the price. So it's something like $80 million. So what is the best result? So they measure within those three systems that I mentioned: physical function, immune function, and cognitive function. They pick some biomarkers that you supposed to improve in complex. So for physical function, it's the VO2 max, 6 minutes walk, and like leg push. So when we take someone who is 50 or 60 year old, it's like, how much leg push amount kilos the person can do. For immune system, it's still this you can propose your own biomarkers, because biomarkers in the field is also a huge problem. So, but they did a great work putting all these things together. So they suggest the type of biomarkers, how good your immune system can respond to new pathogens. It's difficult to measure still, but yeah. And for cognitive functions, there are also some cognitive tests that they measure, but you can propose your biomarker, like, the size of white or gray matter or something like that, and say, okay, I'm changing it. They really, as I mentioned, they did really great job. They have a really detailed guidance on their website, very, very smart designed.
Yeah. Whose biomarkers do you have to improve?
For the participants. So yeah, the main focus of the XPRIZE to rejuvenate 60 or 70 years old. Have to organize clinical trials, and actually it is a problem because it's not a very simple and easy task to organize such kind of clinical trial in worldwide regulatory centers and the FDA or...
That's why you come to Próspera.
Yeah, so it's our unfair advantage that it is somehow at least possible to organize, to recruit these healthy people and give them, administer them these gene therapies. That is very difficult to to administer in other places in the world.
In a couple of months, we're going to know who's the 40 teams. Those are getting to the next round. Now, what do you have to do to get into that 40?
You've already done some paperwork.
Yeah, we just have to register. So
your ideas have to make sense.
Yeah. They have a judgment criteria, multiple judgment criteria. So they judge the overall approach and like how you apply with regulatory things. Will you get like permissions for to run the clinical trial? How experienced is your team? How will you have fundings too for that? So what else were there? How scalable is the approach? How good is the medical centers that you use? So in our case, yeah, we teamed up with a few quite experienced individuals, like Liz Parrish is in our team, XPRIZE team. She has been involved in multiple gene therapies. Glenn Terry, ex-head physician of U.S. Olympic team, is in our team. So he's a doctor who has been involved in multiple gene therapies and other type of experimental therapies here in Próspera. Garm Clinic, the local clinic, they are clinical partners. So we have this facility. They're opening some new facilities elsewhere around Latin America. So probably we'll run clinical trial not only here in Próspera. And what else? Yeah, we have in the team the owner of the company who has been developed has developed multiple gene therapies, including the ones that we use, VEGF, and he's developing some other gene therapies that will be in our cocktails, but he operates in a classical regulatory landscape. But our partnership with them, the way that we just license this gene therapies that is a use for a disease, we license it and repurpose and bring it here to give it to healthy individuals. So yeah, regulatory landscape we have here on Próspera, the Unlimited Bio will fund the trial, so we have a funding for that. We can say that we have investors. Yeah, mostly it is. So they will judge these criteria, and there are some judges, like well-known people. They are listed on the website. Aubrey de Grey among of them, Alex Javaronkov among of them. Some like really cool, smart people. Yeah, and they will just decide. And actually, it's so cool that, as I said, they did really great job. Those guys from XPRIZE, they really in details write it all the judgment criteria, and the one you should follow, like. That we just went, was like a checklist for us. Okay, we still don't have this, how we like work with this risk or whatever, and it was like really easy to work with. So
yeah, we needed to complete this technical application and the protocol for clinical trials. So like we need some already organization with this Garm Clinical Center. So it was kind of very full work. I mean, very detailed protocol. So we need to already to navigate with all these details, the technical aspects, nuances, and made really like detailed one.
Yeah, it took like a whole team have been working on it for few months, yeah, we got many letters of intent for people who will collaborate to us, like will manufacture gene therapies for us, who will like provide some therapies to us, who will be our clinical partners. It was like quite a package. So yeah, that's why I think it will be like already on this stage quite a filtration. I think many team just not able to provide such a package of documents, but it's necessary to run a proper clinical trial on humans, and that we may be sure that you have money, that you have like ethical review, that you will be able to manage, that you have experience to actually execute this, that you have a really good clinical center, that you can scale it. Yeah, all these things are really important.
That's very exciting. Anyone is doing something similar, like a cocktail of interventions like yours?
Yeah, it's still unclear because we don't know who is. We speak publicly, so people may know what we do, but other teams they don't. So we don't know.
So how many interventions do you have in the cocktail?
Yeah, the first tires that we go for, it's 4 gene therapies in combination. 4 gene therapies.
Okay, what are these?
It's VEGF, follistatin, Clotho, and BDNF.
Okay, so right now the VEGF is already accessible.
Okay. It's already approved here on Próspera. We can go to Garm Clinic and inject today.
Let's start with the rest. Let's go through them to the rest of this conversation.
Yeah, sure. AV Clotho and AV follistatin has been used by BioViva. BioViva, it's another gene therapy company.
Okay.
Yeah.
And also Minicircle does follistatin?
Yeah, Minicircle does follistatin, but in form of plasmid. we want
It's
to.
different?
It's different. We go for
That's what Brian Johnson did.
Yeah, we want to go to the more powerful technology based on viral vectors because we think that plasmids are good for a start. That's why we started with plasmid as well. But now we have to move to more, let's say, more effective approaches, such as viral vectors, and we would like to use adeno-associated virus. There are also some new approaches come with cytomegalovirus, but yeah, we will use AAV.
Why is it more powerful? So it increases follistatin levels more, or
It has better transduction efficiency for the cells. So like viruses are very good to like penetrate cells and go inside cells. So they do it very efficiently, not in comparison with plasmids at all. So
and does it also have a kill switch?
it doesn't has, yeah.
And how long does it take? I mean, the plasmid stuff is for 18 months, right? So how about this?
It depends on the company's technology. So maybe they had some variations, but for VGF, it's like different forms of technologies also depends on the protein, what target are you going to implement into the cells, to deliver into the cells. For VGF, we don't need the high expression of VGF like all the time. We don't need it because it could be associated with some side effects, and actually it's really don't need this. We need its increased level for some period of time, for around 2-4 weeks, and during this time this VGF and signaling cascades will organize new vessels. So the main goal of this VGF protein to build new vessels. And after this, its work is done. So we don't need it to express anymore. And these new vessels will provide this therapeutic effect already for 5-10 years. So this injection could be repeated in 5-10 years, but we don't need this high expression of the transgene in cells for these 5 years. We don't need it. So in the sense. So it depends also on the protein functions. So for each therapy, for each protein, it could be different formats, and they could be improved and modified with the aims of their therapy.
Just to finish up the follistatins part. Okay, so follistatin, for those who are listening, you have to think about those muscular bulls or Belgian, right? or muscular dogs or mouses, and sometimes even people have this mutation. But so my question to you is, okay, so how does it compare to, let's say, anabolic steroids?
For anabolic steroids, they could have many side effects, and it's very non-long-lasting effects. For the gene therapy, we see that it was already used in clinical trials in humans with muscle dystrophy, and they've seen really affect muscle growth in these patients. So it's really works because these patients, they couldn't provide and maintain this physical activity as a healthy individuals. And in this cases when they have limited functional abilities, they were able to really improve muscle mass, and they've really detected muscle growth. And it was just one injection. But for anabolic steroids, you need to take it constantly. You need to exercise and do things. So,
all right. So, what about Clotho? Clotho, what is that?
Clotho is one of the young factors that many scientists believe. So it's the protein that's secreted in the kidneys, and it regulates phosphate metabolism and vitamin D metabolisms and cell in the organism. But it was shown in mice studies and monkey studies that it's beneficial for cognitive improvement. So it was already shown in many animal studies that it's really improve synaptic plasticity and improve cognitive functions in animals. So like many companies I know really trying these different approaches with clotting humans, but mostly in like proteins, like in protein format, not like gene therapies. So we also would like to investigate, so with collaboration with BioViva, because they've already like tested and administered to humans. So we hope to collaborate and improve the protocols of using the clotting.
Awesome. So muscle and brain, right? What was the other one that you're still not
VDNF?
BDNF? Oh yeah, BDNF. That's okay. Tell me about that. That's
BDNF
very hyped right now.
Yeah, you didn't have to remember.
We need. It's like it was introduced to us here in the stage that, well, this is the limitless drug, right? Like you do it and there are no side effects and you're going to be an Einstein for like 24 hours or so.
Yeah, you will remember the list of all gene therapies. So yeah.
So BDNF, it's a brain-derived neurotropic factor. So it's like the most maybe known one, that it's also already shown its efficiency for cognitive improvement, for synaptic plasticity, because it's really that factor that we need to form this dendritic connection, synapses connection between neurons. And it also was shown in clinical trials for patients with Alzheimer's, and it showed some effects on patients with this severe disease. So, but we think that it could be helpful for more preventive stages when people have like some mild cognitive decline, and it would like boost and prevent them for this like slow down this cognitive impairments in the future. And also BDNF is good actually for muscles, because it's responsible for forming these neuromuscular junctions between neurons and muscle cells. And it's a real problem with sarcopenia, because with age we lose this neuromuscular junction. It's very important, not just like muscle mass, because muscle mass wouldn't mean anything if we can't control it, and from our nervous system wouldn't manipulate this muscle mass. So it's very important to prevent these neuromuscular junctions disimprovements, and BDNF and VGF, it's like these factors that supports this part.
Okay, I kind of wanna just inject myself in with everything that you guys offer right now, but okay. So the one that you're already offering is
vascular endothelial growth factor.
all right. So
What is it?
Yeah, it's actually it's a gene responsible for formation of new blood vessels, and our blood vessels they responsible to bring all the oxygen and nutrition to our cells and tissue and remove all the waste. So this gene therapy, by simple words, upgrades our inner delivery system like to the new level, and it's what I say. And it has been shown that decline of vascularization leads to multiple problems all around our body. So we licensed, as I mentioned, this gene therapy from a company who had it for a while already. So we knew that it's safe, and we knew that it's worked with patients with this disease. They got much better with this gene therapy, so we know that it's efficient. And so we brought her to repurpose with and we look for meaningful biomarkers, as you remember. So we don't want to say, just one short story. Just we had a booth on Radfest last year, and people just, were in front of us. Were selling water. This water, just water, was collected and packed such a way that now it can cure everything. This is a problem of the field, that like everyone claims that they can cure everything, but at the end they don't really. And so and I was in front of those guys pitching our gene therapy, which is just target one process in our body, but a real one. So I mean, it sounds not that like really cool when you think about it, because we have to compete with all this, like snake all around, like the magic waters and all the thing. But yeah, our gene therapies increase. We expect it to increase muscle oxygenation. That's the thing that we measure. So we do intramuscular injections with the biggest muscle in our body, so lower muscle, like around 75 or 80% of our muscle mass. So we do multiple injections on different muscles in our legs to build new capillaries and to bring more oxygen, because oxygen is what leads to increase of VO2 max. So if I have more capillaries in my muscle, I can more easily increase my VO2 max with less training. So this is the point. This is just a starting point that we start from. Another thing that we mentioned with this gene therapy, we noticed it with this gene therapy. It happened before I got bald. So yeah, so that when people with this disease, they lose their hair on the leg, and when people got this treatment, there was a hair grow on their leg. People were like complaining to over hair grow in their leg in a place where it got injected. So we repurpose it for prevention of hair loss. And actually the same target with minoxidil, the most common drug for the prevention of hair loss. It also targets VEGF, but minoxidil has multiple like side effects, and people like have troubles with it, and people have to take it permanently. So we repurpose it for topical scalp injections for prevention of hair loss. It works not in my case. It works in a case like with people with early stage hair loss. So maybe me 10 years ago, it would be a great time to start this company, but I missed it. So
when they have the hair follicles, so they should exist in the head.
And just to start with this gene therapy, so we broke it for the most obvious indications, but also we want to extend it because like we can now start doing it into different organs, not just muscle or skin. It could be also in the future like more systemic gene therapy, because it's hypertension, high blood pressure. It's a kind of problem when we age that can accelerate our aging. So as soon as someone has the blood pressure of someone starts to grow in average, it could be a good time for systemic use of the gene therapy to bring it back. It also could be a nice application for this gene therapy.
So it's been used for like 10 years already, right? In Russia. Why isn't it used anywhere else?
Right. I think the first human took it around 2009, 2010, got approval in Russia, and after that, even in Ukraine, around 2011. That company were working to bring it to the US, but obviously after 2022, they just stopped this initiative. Maybe they will try again, but they was going. And it's a problem because even for the disease, people in the US, they don't have this gene therapy. And it's quite a severe disease that leads to a leg amputation. People can't walk and end up like just losing their leg. And we actually expect people to come to Próspera for medical our gene therapy even with this disease. And why they didn't anywhere else? They didn't do it anywhere else because they can't do it for prevention indications. It's the only place where we can do it for prevention. We can repurpose it now and just start giving it to healthy individuals. That's impossible anywhere else.
For those people who cannot come to Próspera, do you have any low-hanging fruit biohack that they could maybe do, but it must be a low-hanging fruit, so it cannot be exercised 3 times a week because that takes a lot of time, right? So something simple to do, but have like outsized effect.
Usually it's like a very individual story because you should hinge on your biomarkers and understand what problems you already have in your body, because it's kind of non-logical and kind of unrational to do something without knowing what's wrong currently and what you want to improve. Maybe if you have like some problems, if I would go with something, I would say it's plasmapheresis. If you have some inflammatory markers.
Plasmapheresis.
phoresis.
Phoresis.
Yeah, it's a procedure that's kind of dilute your plasma, and by this, organism dissolute these pro-aging factors, inflammatory factors like bad cholesterol, bad lipoproteins. This is like everything that you've accumulated throughout your life, and you know that's like in your blood test you have this like not very good range of these substance markers. You could go through this procedure and a little bit to maybe improve.
Yeah, but to be realistic about all the thing, and there's no magic pill. And people who say that usually that there is a magic pill, they try to sell you something. This is the reality why I came here and started to build all these biotech companies, because like I don't need money. I don't need I would enjoy the beach and having fun and just enjoying life, because I understand that we don't have a solution. We really need to accelerate. This is the problem, and people really would like to learn the low-hanging fruit, but even if you speak about Brian Johnson, I think the best thing that he did in his protocol, that he has been doing it for around 5 or more years. This is the low-hanging fruit, that just to do things long-term, because people people think that if they have been destroying their bodies for decades, if someone have been smoking for 15 years, you can't take a pill and just recover it. You have to keep working 15 years to change it. And and the best thing that Brian Johnson did, not all the supplements, not sleep, not eating less, not his diet. The best thing that he did is that he actually have been doing things more than 5 years, really taking care about his health. Yeah, it's unfortunate, but it's a reality. It's a current reality, and there's no magic pill. We have to really, to make a difference, we either have to work really long term now. It's still not a solution, because it will lead us to die. Even Brian Johnson protocol will lead him to die. And we need to build new solutions. We need to engineer the solution, and it's the only game changer is the one that we haven't built so far. We have to build it.
Best way to predict the future is to invent it yourself. What's one thing that you strongly believe to be the case, but very few people agree with you on?
I think the ones that I just said. And the last question, that people just don't understand that it's still complex and we have to engineer it. The most people, they try to get by bicycle to the moon. All these supplements and lifestyle interventions, it just, you can drive your bicycle very fast, but you never will get to the moon with it. Our life and well-being, or people whom we love, it's the only meaningful thing that we have, right? Our life and well-being of us and people whom we love. It's the only thing that we have to, the only thing that has value. All the rest is just ideas or numbers or whatever that's not really exist. And we have to work hard to, to save this value for us while we are and people whom we love are still alive.
All right. How about you, Anna? You have some strange, unpopular opinions.
Yeah, actually, there are a lot of stereotypes in the longevity fields. And different approaches. Most of the people, for example, believe that supplements will save them from the death or something like this. Or just, I don't understand why we waste so many time for the supplements and lifestyle techniques, or maybe I don't know, some very questionable approaches, because it's so real that we don't have currently the working solution, and I don't understand why all the longevity fields doesn't work on some very solid approaches to target these bottlenecks. So considering there are just few maybe companies or people who is doing this, I would say it's unpopular vision on the longevity field.
I see. You know, I have a large supplement stock and I never take it when I travel, but I barely notice any difference when
This is the point.
100 pills doesn't make a difference in your
Right.
life.
Maybe you feel, like you feel just better because you're doing something. In the past, in the middle centuries, people seen it, like, and went to the church, and where Pope paid to the Pope some money, right? And the Pope said, "Okay, now I forgive your sins. You can go." And people went with, with a nice mood and whatever that they paid their sins to the church, but. Yeah, it's the same. When you buy your supplements, you kind of pay this thing to the church, psychological, to get yourself feel better, and maybe it's even good thing because you don't stress yourself much, that you don't do much about aging. So it's also a good thing. But yeah, it's unfortunately that's why we don't take much supplements at all.
Okay, so to finish up, could you tell me how can people give you money? So I assume the way that you're generating income is someone might fly down here to Próspera and take your gene therapies. Those are offered in the GARM clinic. Is that correct?
Right. Yeah. Today it's available. Only one gene therapy is available today. It's a vascular growth factor. Yes, in GARM.
But you're getting a cut from it, right?
Yeah, sure.
Okay,
Yeah, sure.
good.
Yeah, of course.
Capitalism for
Yeah,
that.
yeah. And it's a way for us to start generating revenue and reinvest it for more therapies and build a cocktail, sell the cocktail, reinvest again. And it's quite kind of a quick feedback loop for us here. That's much quicker than when in normal environment you have to wait like 15 years and whatever.
And moreover, we can collect this data because it's also very useful for us to get this data and to see what's the results, what's the efficiency, so we could improve something.
Yeah, it's here it's a nice opportunity about Próspera that you can do self-funded clinical trials. So when people pay to participate, self-cost of the trial. So we normally need investments only until the clinical trial, and after that. We don't need a budget for that as a company. We don't need to invest in it. It's clinical trial is funded by people who get therapies, and after that, after the clinical trial, we already can start making profits on it. But on stage clinical trial, just a self cost. But still, we collect data on it. There are some issues with that because it's difficult to do like placebo control tests or whatever, and because it's very important as well for us to collect data because we believe that placebo effect works, and we don't want just to take placebo. We want something better than placebo and other approaches. So we solve this issue the way that we offer people to come. We give people discount, like 25% to the therapy so they come 2 times, and they don't know in which time they get placebo or therapy. So they get therapy for sure, but they don't know either it was first one or second visit. They will know at the end, but we will collect that data first, and after we will find out what works better with placebo control.
Well, guys, this was a different episode. So far, every single athlete that you've seen here was talking about eat well, sleep well, and these conventional approaches, which are very good, but we know they are not. You cannot cycle to the moon, right? But here something new is happening, and it's more experimental, but the payoffs are potentially also much larger with a cocktail of gene therapies that hopefully you guys gonna be successful with that. So thank you very much for coming, and go visit their website, Unlimit Bio.
Yeah, thank you for having us.
Thank you.